Hey everyone, my name is Joseph. I'm a graduate of USC and a fintech startup CEO in the financial district of Los Angeles, California. And today, we're going to fix the American healthcare system. Giving every American access to healthcare that provides the essential services to keep society healthy and productive is actually very simple. And it's imperative that we do so because no matter whether you're young or old, liberal or conservative, this issue impacts all of us. As an employer, it's impossible to hire many full-time employees because the burden of providing health care is on the employer, and employers are spending a lot of money to pay for private insurance to provide their employees health insurance, money that could be better spent if it was exchanged into your pocket if you worked 9 hours for me or literally any other reason other than getting lost in the vortex we call the American healthcare system. Additionally, this inefficient method of providing healthcare forces employees to be locked into a job that they may not particularly enjoy or have any upward career mobility just to have access to healthcare. Is healthcare a human right? Absolutely, especially if you're paying into the most expensive healthcare system in the world and contributing your tax dollars to a government in which you expect them to reciprocate security and social welfare as part of the social contract. That's basic political science 101. An example of this is Canada, or really any developed nation that provides their citizens universal health care or any social service in exchange for their tax dollars. If the United States government recognized health care as a human right, then we wouldn't be living in a country where people are scared to get sick, because getting sick would mean risking losing your jobs, because that would mean taking time off work, all while having to pay premiums and co-pays just to see a doctor. The insurance that employers provide isn't even really that good, and it's very expensive. Now, with that said, I'm not trying to be all kumbaya for the rest of this video because this is a serious issue that requires a serious plan because we have a lot of issues to address, and this plan needs to satisfy everybody, and that means the people, the government, and the insurance companies. Yes, I know, the insurance companies as well, because the idea of completely eliminating health insurance would be completely catastrophic. So let's not swiftly eliminate all health insurance in one swoop. So let's professionally evaluate our American healthcare system using key performance indicators. A key performance indicator, or KPI, is a quantifiable metric that measures a business's performance over time. KPIs can help businesses make better decisions by providing objective evidence of progress. And this can be used not just in businesses, but all organizations or structures. For example, if you're a librarian, then a KPI for a library would be how long does it take for a book to get back onto the shelves once it's checked in from a customer, right? Something that quantifiably evaluates the processes of the staff, tasks, and SOPs. So as you can see here, we have 9 benchmarks to evaluate our United States healthcare system, and we've missed the mark on every single one of them. And if we were to evaluate process adherence or count these benchmarks as SOPs or process adherence, then the formula for that would be processes followed correctly over total processes times 100. So our process adherence is 0 over 9 times 100 equals 0%. We've literally missed the mark on every single benchmark and have completely failed the American people as a system, which is a big, objective, quantifiable reason as to why we need to fix the healthcare system. The U.S. healthcare system is one of the most expensive in the world, consuming 17.8% of our total GDP. That's $4.5 trillion annually. Yet, it delivers outcomes that are objectively and considerably much worse than other developed nations. The key to fixing healthcare prices is cost control, increased competition, and getting the burden off of businesses to provide healthcare so that they can go back to focusing on job growth. Administrative overheads such as billing, paperwork, insurance bureaucracy, comes out to 30% of our total healthcare spending, which equates to about $900 billion a year. Prescription drug prices are 2 to 3 times higher than in Europe due to lack of negotiating power. And finally, to round up the issue of healthcare prices, hospitals are charging consumers wildly different rates for the same procedures, and there's little transparency for patients. The second issue is that the employer-based system dramatically hurts United States businesses because United States businesses are spending up to $1.3 billion a year just to provide employees health insurance. This discourages employers from hiring full-time, as well as inflates labor costs, and keeps American companies from being competitive globally. The final issue that we'll be addressing in our healthcare reform is the biggest issue, which is uninsured and underinsured Americans. As of today, we have 27.6 million Americans that are uninsured. In addition to that, another 44 million Americans that are underinsured, meaning that their healthcare access or services is inadequate. Also, don't forget that medical debt is the leading cause of bankruptcies in the United States. Why do we need to address this? Well, lower healthcare costs would boost other industries such as retail spending and housing, and that would free up a lot of dollars for consumer spending. Improved worker productivity due to better health outcomes could potentially add up to $100 billion annually to the total GDP. Seniors don't have access to mental services and counseling during an epidemic of loneliness as defined by the United States Surgeon General. We can improve the quality of life for all American citizens and enable everybody to live with dignity and without fear of getting injured or sick in the United States of America. My solution in American healthcare reform is to provide a hybrid model that provides both universal coverage and private market competition. A free market, universal healthcare plan that is absolutely achievable by combining elements of successful global systems such as Germany and Switzerland and combining that with the free market enterprise of America. This hybrid model solution will provide basic universal coverage for all low-income Americans by creating a public option that's similar to Medicare that is available for all Americans. We will have to go back and reevaluate the poverty line because currently right now it's not reflecting what society needs. We need to adjust it so that it's at $75,000 annually per family of 4, which is 250% under the poverty line. And higher earners can opt into the public option if they find it attractive by paying an income-based premium. Now, what this would do is expand healthcare coverage to all Americans so that if you're a tax-paying American citizen, you'll have access to the basic universal minimum coverage that's necessary to be a productive and healthy member of society. Perhaps even dental work, basic dental work. If you have a filling or if you have a root canal that you need to get done, you can do that for free instead of going on an employer's health insurance that doesn't really include dental anyway in your HMO, right? Honestly, 99% of the joy and fulfillment of having a full-time job besides the salary and consistent paycheck is actually having access to dental and PPO, which you're only allowed to if you are full-time, which companies can't do because healthcare is so expensive. So at this point, you're probably on board and you agree that the American healthcare system needs to be reformed. And you're probably thinking, okay, this is a good plan. But now let's get to the real questions. How much? How much is this going to cost? I'm not going to lie, expanding healthcare coverage to all Americans is going to cost about $400 billion annually. But we can offset these costs with these strategies. Number 1, eliminating Medicaid redundancies would save us $150 billion per year. Number 2, enabling Medicare to negotiate drug prices would save us about $50 billion per year. And number 3, a new payroll tax of 2% on incomes higher than $250,000 to generate about $100 billion worth of funds. You might have to adjust this because the math needs to add up to 400 billion, but if you crank that up to about 3-4%, it should get you there. And this is doing it practically without raising the national debt. So what's the economic impact of executing this concept? Well, besides expanding healthcare to all American citizens, you would dramatically reduce the ER visits, which is the #1 driver of uncompensated medical expenses. Most importantly, this would eliminate health-related job losses. Illness-related productivity losses cost up to $260 billion a year. Okay, so now that we have our new healthcare system, let's talk about the opportunities it provides to get the burden off of businesses to provide healthcare. This plan will provide employers the opportunity to opt out of providing healthcare by paying a 5% or higher payroll tax, whatever percentage that makes the math work, but it's still lower than the 12 to 15% that employers currently spend on providing insurance. And most importantly, in this plan, small businesses with under 50 employees will be fully exempt. This will give small businesses the opportunity to compete, scale, and hire new talent accordingly. Employees that are working for employers that have opted out of providing them health care can opt into the public option of the universal basic coverage that the hybrid solution provides, or they can explore their options in the free market looking for a private insurance company. Now we circle back to the insurance companies. Respectfully and disrespectfully, all I have to say to you guys is do your job and provide excellent service to gain more consumers. That's how you're going to compete in the amazing American free market. So, what are the economic impacts of shifting the burden of providing healthcare off of businesses? Number 1, this would potentially save businesses up to $500 billion per year, encouraging more hiring. Number 2, it would invigorate entrepreneurship and the desire and chase to make new ideas into industrial realities. And number 3, most importantly, all Americans will not be tied down or locked into a job that they don't like just for healthcare. And this will promote social and career mobility. And finally, the third part of my healthcare reform solution is to allow Medicare to negotiate drug prices. We must allow Medicare to negotiate drug prices and allow the government to barter and negotiate for drug prices just like every other country does. We have to cap insulin and other life-saving drugs to $50 a month. And we must allow safe importation of drugs from other countries. The economic impact is potentially $456 billion in savings, according to a report by the Congressional Office Budget in 2023. It would mean lower private insurance costs through competition. And finally, Americans still have the option of adding on supplemental private insurance to their public option. If we do all the things that I've outlined in this video, we can potentially provide healthcare for all American citizens, number 1. Number 2, we can increase the GDP by 0.7% every year. And number 3, and most importantly, we can accomplish all of this without raising the national debt. Thanks for watching, everybody. If you like what you've seen, please subscribe, like, comment, and share with your friends so that we can spark good conversations that provide meaningful, substantial, and feasible solutions.